monon heis estin uranos, alla kai adynaton genestai pleius, etit hos aidios aptartos on kai agenetos legomen, proton diaporesantes periautu, doxe egaran ho discopu menois adynaton hena kai monon eina iauton.
Hello, everyone. My name is Gabriela Flora, and I want to share with you my perspective regarding one of the new realities that emerged since the outbreak of COVID-19 pandemic. That is the fact that medical professionals tend to forget about human values. My humanistic response will revolve around the George Engels biopsychosocial model and the echo chamber phenomenon addressed to those that can make a difference in this matter. I am a medical doctor and currently finishing my PhD in philosophy of medicine at the University of Bucharest. Last year, I was a visiting scholar at Hadassah Medical School at the Hebrew University of Jerusalem. There, Professor Lorit Shaham and her professional peers shared with me their experience in introducing medical humanities within the medical education curriculum. My commitment is to enhance medical reasoning and practice such that future doctors may be trained in improving their skills to meta-analyze their thinking and the way they interact with patients. After finishing my PhD, my theoretical research on metacognition in medicine and the mind-body problem, I aim to investigate how humanities can improve metacognitive processes in clinical reasoning and how they can prevent burnout in medical practice. In this short presentation, I invite you to travel with me on the realm of human values and think of the academics that inspired you in this sense. We will begin with the current global situation, go a bit backwards in Aristotle's time, and then we will see how things, or we, medical professionals, need to be transformed for the benefit of our patients. In Romania, as I presume it happens in some other countries as well, we are currently witnessing a crisis within the healthcare system in an era of fake news and lack of trust in the authorities, like political, financial, and educational authorities. It is known that for a system to change, something major needs to happen, something like a catastrophe, or a large group of people to wish this transformation and try doing something about it. I will dismiss the politics and the financial perspectives, and I will tackle instead the medical care dimension in conjunction with the way medical students are being educated. Moreover, I will discuss about doctors, patients, and their humane side and how education can and should mold it. Physicians as professionals represent an intellectual authority. Nevertheless, the current pandemic brought at the surface a new reality, that a great majority of people do not listen to medics' advice, like physical distancing or wearing masks. Have you asked yourself why many people do not take into consideration what doctors have to say about prevention, and why they, the people, respect rules only if a legal authority is imposing them? Now, two important answers are because people do not completely trust us, physicians, and because freedom of expression is mistaken for responsibility. This confusion may be caused by the flow of fake news, fake information. People do not know anymore what is real and what is not real. This is why conspiracy theories have their audience, which cannot hear or see anything else but well-fabricated stories with their own logical constructions. It seems that people are not uneducated, but people who feel that they are not included in society, people who lost their trust in the authorities. Going deeper into the core problem of my presentation, namely, why are people not listening to medical professionals' advice? We can ask ourselves again, why is this happening? Then we will reach a harsh answer. The population has lost their trust in doctors because they did not receive what they expected when they were patients. that is clear, non-academic answers described in a common and more friendly type of language, more humanely. In these times that we proudly call them modern, there are old things which we continuously forget. These obsolete things are called human values. Human values are the virtues that guide us to take into account the human element when we interact with other human beings. Human values are, for example, respect, acceptance, consideration, appreciation, listening, openness, affection, empathy, and love towards other human beings. Now, what does medical humanities have to do with this issue? The answer is everything. What exactly is this concept of medical humanities? First of all, medical humanities is a field that includes many different disciplines. Not all the disciplines are in humanities. Some are in fine arts, some are in performing arts, others, like anthropology, are from other disciplines like social sciences. So, how does medical humanities work? Materials and approaches from different disciplines are used to consider topics in healthcare and in the care of patients, along with the doctor-patient relationship. Medical humanities is based on one essential idea about what medicine is. Medicine is a practice that is both an art and a science. Scientia, in Latin, or science in English, represents knowledge in general. Historically, science referred to all kinds of knowledge. It's like a tree with multiple branches. The way we define science today is much more narrow. Science is specifically about the natural, the physical, and material world, minerals, vegetables, insects, animals, and so on. In medicine, it's about the patient's bodies. Science studies one subject, that is nature. In particular, scientists study how these objects work and how they behave by looking at physical processes, macroscopic, microscopic, and subatomic. Science uses a specific method, the scientific method. This method means that a scientist knows about nature by observing it through experiments and with the natural objects taken from multiple collected samples. The results of the experiments must be consistent, and other scientists must be able to replicate findings in different labs. The results must be measurable. In medicine, we study the human body as an object to understand the natural, the physical, and physiological behaviors in health and disease. The art of medicine is also built on knowledge, but a different kind of knowledge. It is the knowledge of the humane, of the human being, the values, the ideas, the beliefs and behaviors of human beings, of the individual, how we behave and act and think and feel towards each other, in societies and also cultures. Scholars and researchers in the arts and the humanities agreed upon methods. They study texts and words and images to understand and explore behaviors, ideas, and values. In short, the sciences are the discipline that study nature. The humanities and arts are the discipline that study human nature. Why does this matter in medicine? It matters because the art science view of medicine is what underpins the biopsychosocial model as proposed by George Engel. Engel imagined a model of comprehensive care of the patient that would include all of these systems working together dynamically. At the center is the patient, because Engel believes strongly in patient-centered care. If you think about the first years of medical schools, the courses are heavily science-based. Anatomy, physiology, histology, biochemistry, and others. But if we think and look at Engel's scheme, we see that these courses fall roughly in the bottom section of the biopsychosocial model. The human context is the upper part. Engel insisted that they were all integrated, the bio with the psycho, the social, the cultural, and the biosphere. Why do medical humanities need to be taught? Thinking about and understanding human context is essential to good care. By that we mean that patients and often family members' personal experiences of an illness and even our own personal and professional experiences of caring for patients. Within the patients and also within our own community or culture, it really does matter greatly to patient outcomes in all these psychosocial levels. Most, if not all the things that I presented so far are not new. I only reiterated principles that Aristotle taught. He considered that people acquire virtues, like good habits, through practice, and that a set of concrete virtues could lead a person toward his natural excellence and happiness. Morally good habits promote stable and predictable behavior and foster coordination in an imperfect world like we are experiencing now. Habits, natural dispositions created through the repetition of actions, underpin virtues. Aristotle did not regard ethics as an exact science. He said that matters of conduct are not found in an exact system, not only in dealing with specific cases of conduct, but also with respect to the general theory of ethics. He explains that a person must both investigate the nature of virtue and learn through experience to discern, consider for themselves, and competently judge the particularities of each situation's circumstances. Aristotle thus emphasizes both the difficulty of devising general principles of moral action and the importance of perception and judgment in practical decisions. One's practical wisdom is a kind of insight, perception, or sense of what to do. That is what we now call metacognition. Now, the new element that I offer in my presentation is a humanistic response that regards the need to come out from this echo chamber, the environment in which we encounter only beliefs or opinions that coincide with ours, so that our existing views are reinforced. It's exactly what we are now doing in this event and other events in medical humanities. But alternative ideas are not considered here. This is why there is a risk of remaining trapped in this chamber where colleagues of ours that are not included in our group are not remembered about the humane aspect of practicing medicine in modern times as much as they are connected with the new technologies and innovations in medicine. After having had this journey on the remembering path of human values, stated before since antiquity, those that have a word to say within the medical education system can manifest their support on this initiative of introducing medical humanities field within the medical curriculum, as much as science is supported. Around the world, some universities have already done it, but there are not still so many to stop spreading the word. The so-called hard skills of science that contribute to very knowledgeable professionals can only be complemented by the so-called soft skills of the humanities that make the professionals more humane with respect to their patient and not only. When the majority of medical professionals will be able to know how to better communicate with their patients, then the population will tend to listen and trust them without legal authorities needing to intervene in public health issues. Thank you all for watching, and great thanks to the organizers of the virtual symposium, especially to David Serdio, Jonathan McFarland, and also Emil Toescu, who's a professor at Birmingham University and a pioneer in medical humanities at the Institute of Transdisciplinary Discoveries at Pécs University, Hungary. Thank you for watching.
Ότι του μόνον heis estin uranos, αλλά kai adunaton genestai pleius, etit hos aidios aptsartos on kai agenetos legomen, proton diaporesantes periautu, doxe egaran ho discopu menois adunaton hena kai monon eina iauton.